Now we'll try to look at another inflammatory condition. Okay, and I think this is in the pelvis. So this is what is known as sacroiliitis. Okay, sacroiliitis. So you're having inflammation of the sacrum and the ilium. That's basically where they are meeting, right? Where the sacrum and the ilium are meeting, you're having inflammations there. So what we have is actually inflammation of one or both of the sacroiliac joints. Okay, and this is a joint located, but that basically you say what the spine is meeting the pelvis there. So it causes a lot of issues which we are going to look at. So it's painful inflammation of the sacroiliac joint. That's the joint between the sacrum and the ilium. So functions of this joint is to help you support the weight of your body, that's the upper limb, so that you can be able to stand and can be able to carry your body along. So you are now having the issues, right? So if there's issues with this, you know that your ability to be able to carry your body is being affected. So symptoms is a lot of pain and stiffness in the lower back, buttocks, and the hip and thighs, and pain may worsen with prolonged standing, stair climbing and running. So it's often mistaken for other causes of lower back pain. People don't really know that there's actually inflammation of this joint. So it may also present with morning stiffness. That's probably you have not used that joint for a very long time, so when you want to use it again, you have a lot of resistance. So causes could be all those inflammatory conditions, degenerative conditions, trauma, or any activity that is making you use that part of the body too much. Infections too, but it can also have it's rare, but it can also have it. So you diagnose from all those physical examination and what they call it. Physical examination is very important, and clinical history. Okay, X-rays, MRI. You do lab tests to look at all those inflammatory markers if they are heightened up. So treatment options include NSAIDs for pain and inflammation, and disease-modifying drugs, the physical therapies. Lifestyle is they should avoid prolonged standing, use all those corticosteroid injections just to reduce the pain.